another edition of Triad Today, coming to you once again from the Senior Botanical Garden in Kernersville. We'll tell you more about them later on, and later on is when the roundtable shows up, and we'll get into all sorts of controversies then. We also have a COVID update coming your way and lots more. But where we want to start, and it's always a privilege to get this gentleman to steal a few minutes of his time away, our good friend, Dr. Bob Shackelford, president of Randolph Community College. Welcome back, sir.
Glad to be here, Jim. Good to see you.
Now, you're somebody that does not like to brag on yourself, but you will brag on the college. And so let's start with this. I saw this email that said that you all had to receive some kind of a national ranking. What's that all about?
Well, Yahoo Finance contracted with a national group called Smart Asset. And Smart Asset is a group that tries to help consumers know where their money is best spent.
Okay.
And one of the things that they studied was the top community colleges in America. And they use criteria of student-faculty ratio, the total cost of the education, and the percentage of students who either graduate or transfer to a four-year university.
Right.
And based on those, out of 840 community colleges in the country, we were ranked in the top 10.
Wow. That's I tell you, if we had a studio audience, we would applaud that. That's pretty good, Bob.
We were very, very proud of that. We work hard to do the right things, but we don't do it for the rankings. But when something like that comes across my desk,
Absolutely.
I say, wow.
I just think it's great. You know, community colleges in general, as you know, have received a lot more attention over the past 3, 4, 5, 6 years, that kind of thing. Why is that, do you think?
Well, our stock has risen in recent years. I mean, it's common now for us to be mentioned in the State of the Union address, and even Erskine Bowles, when he was president of the university system, made the comment that the community colleges are the economic engine of North Carolina. And so we used to be seen as just vocational schools. If you can't go to college, go to a community college. And right now, we are considered quality education, and the universities are seeking our graduates who go and actually outperform the native students the last 2 years. So we have great relationships with the universities. They're seeking our graduates, and our graduates are being very, very successful.
And it doesn't hurt to have the First Lady of the nation being a real cheerleader and professor herself with the community college.
That's exactly right.
What, getting back to the bragging part, and what do you think sets Randolph Community College apart from, say, a traditional four-year university?
Well, I'm a product of the universities, and I'm a friend of the universities and friend with the chancellors here in the area. And I used to be in the universities. I was a faculty member, a dean, a vice president. I wanted to come to the community college system because I particularly believed in its mission. I was raised poor, and I was down here. The universities tend to say, here we are. If you're fortunate enough to get up here, we'll save you a seat. I want to go down to the people who were where I was and meet them where they are and help them get as far as they can go.
Right.
And the way we're able to do that is that we have smaller classes. And so when I taught in universities, I would teach in lecture halls of 100, 200 students. If somebody dropped out, I didn't even know their name.
Yeah, that's right.
So we have the smaller classes. They're taught by full faculty, full professors day one, not graduate student teaching assistants. And our faculty are rewarded in their careers for teaching, for advising, for their office hours. They're not rewarded for grants, publications.
Yeah. You also have done a lot of work networking with area industries and businesses. Very quickly, before we lose time, that translates into careers when the kids and the adults leave Randolph Community College. How are the graduates doing when they leave?
Oh, the graduates are doing great, and our graduates are making good money in good careers that are not going to be sent overseas. And you take, I can name a list of our programs that every graduate we have will have 3 to 5 job offers waiting for them when they get out. It's not a matter of can I find a job, which job am I going to select?
How about that? I just think that's great. And that's a good, not to embarrass you, but it's a good reflection on you and where you've moved the college in the right direction. and we appreciate all you've done with that. On screen, let's let everybody know where they can check out more information about this top 10 community college in the nation. Randolph.edu is the website, randolph.edu. Again, congratulations on the ranking, but more importantly, congratulations on the networking and the success you've had in trying to get folks off on the right foot and get them a job.
Thank you, Jim. I still love what I do after all these years.
All right. We'll be right back. Today, and once a month, we like to check in with the good folks from Novant and get an update on COVID and vaccines and the like. And we have that report for you now. Let's watch.
To date at Novant Health, we've administered over 546,000 doses of vaccine. That's more than 277,000 individuals we've fully vaccinated. We are seeing an uptick in vaccinations happening, which is encouraging, especially when we look at where we are with community spread and hospitalizations across the communities we serve. We continue to see a high number of COVID-19 hospitalizations across all Novant Health hospitals. The percentage of tests that we are performing that are positive remains high, but is slowly trending downward. In our greater Winston-Salem market, about 17% of the tests we perform are positive. In our Charlotte market, about 14% of the tests we perform are positive. In our coastal market, about 19% of the tests we perform are positive for COVID-19. Those numbers aren't climbing as quickly as they were a couple of weeks ago. And in some of our hospitals, we've seen a plateau and a slow trend downward in our inpatient volumes. Of the 450 to 500 COVID-19 patients we are caring for at any given time in the hospital, 92% of them are unvaccinated. And the number gets higher among those who are the most ill. So 96% of patients in our ICUs and 96% of patients on ventilators right now at Novant Health facilities are unvaccinated individuals. Vaccination continues to be our best protection from severe COVID-19 disease, hospitalization, and death. As a reminder, all of our vaccination sites take walk-in appointments. It's quick, it's easy, and it provides vaccines which we know are safe and effective. We've used them for some time now. Individuals who've not been vaccinated can start the vaccine series. We're also administering a third dose of vaccination to individuals with severely immunocompromising conditions. So people should talk to their physicians about whether they qualify for the third dose of vaccination and when they should receive it.
So I'm going to give you a little update about kind of the pediatric trends and what we're seeing that's different compared to previous COVID infections. Obviously, things are a bit different with the Delta variant, and what we're seeing is a lot more infections and transmission between children than we saw in the past. Part of that's because obviously more people 12 and above can be vaccinated. And what we're really seeing is especially those younger patients under 12 are spreading the Delta variant because it is very contagious, but also they're obviously not vaccinated. Kind of a strange time because normally in pediatrics, it's very seasonal. And typically about now is when it tends to be quieter in the hospital. But because of COVID and all of the other infections that probably were somewhat limited in the past because of the mask wearing and social distancing and hand hygiene and everything that we've done over the last year and a half, we're seeing co-infections. So we're seeing COVID, we're seeing other infections such as RSV that are really, really prominent right now. You know, we're seeing now that over a quarter of infections with COVID are pediatric patients. And fortunately, it tends to be still predominantly a bigger issue for adults in terms of death or serious illnesses. But when you have over 25% of the cases are now pediatric, we are definitely seeing those numbers rise, and we expect over the next few weeks probably for those numbers to continue to increase and continue to encourage people to do things that we know works. You know, the science supports obviously getting vaccinated, hand hygiene, doing whatever you can to increase your aeration or being in a place where you're not too close to people and there's plenty of airflow, wearing a mask, social distancing. We're going to continue to encourage all of those things because we are seeing that these numbers are continuing to increase. And as I mentioned, we expect them to continue over the next few weeks or month or so.
And our thanks to Novant Health for that report. For more information, visit www.novanthealth.org. We'll be right back. On Triad Today, and always glad we can spend a few minutes with the good folks from the Z. Smith Reynolds Foundation and two lovely ladies here. They've been here before, but we haven't seen them in a while. On my immediate right, Shaheen Tolles, Director of Communications for Z. Smith Reynolds Foundation, and she brought along a special guest, Loretta Bell, Coordinator of Sabbatical Travel and Meetings, and we welcome both of you. Good to see you.
Thank
Good to
you.
see you.
Shaheen, I'm going to start with you. Just to give a quick overview for maybe people who just moved into the area or don't know, what's the mission of the foundation?
Sure. Well, the mission of the Z. Smith Reynolds Foundation is to improve the quality of life for all North Carolinians.
And the sabbatical program that we've talked about in years past, and you emailed me something about it recently, let's bring people up to speed on that. What is the sabbatical program?
Great. Thank you. So, often the most creative and inspirational nonprofit leaders are so dedicated to the work that they do that they just reach a point of burnout. And so in 1990, the Z. Smith Reynolds Foundation established a sabbatical program, and it's really a chance for nonprofit leaders to take 3 to 6 months off to do nothing related to work, but to renew, refresh, and come back to work, hopefully with newfound energy and newfound momentum.
Well, I think that's great. I mean, we've heard about that, and it still goes on with colleges and universities, and professors will take sabbaticals, and ministers and rabbis will take sabbaticals. But this is great that nonprofit leaders, because they have such responsibility. Loretta, let me turn to you. Are these recipients of these sabbaticals, are they compensated in any way? Do you give them money?
Yes, so the foundation awards up to 5 sabbaticals every other year, and to the nonprofit leader, $30,000, and to the organization, $10,000. And of that $10,000, $5,000 must go towards the benefit of the organization for transition expenses and also to
Because they've
help
got,
when they leave.
I'm sorry to interrupt you, but if somebody's the leader's on sabbatical, they got to have some help, and maybe that can
Yes.
help them in staffing and that kind of thing.
Exactly.
So you said $30,000 if I get the sabbatical, and you're going to give 5 of them per year.
Yes.
Now, who exactly is eligible? Because Shaheen referenced the fact that the leaders, but that's a broad term. Who
It is,
exactly
yes.
is eligible?
Yes, so any individual in an executive nonprofit, in an executive leader position that has been with their nonprofit for at least 3 years to an
Okay.
executive level position are eligible to apply for the sabbatical.
Okay, so I can't just go be named the CEO of your thing. Just tell Mo he's leaving, I'm going to take over, and I don't get a sabbatical.
No, it doesn't work that way.
Shaheen, seriously, now when is the next time somebody could apply for this?
Well, actually, sabbatical applications are now available on our website for next year, and we're really excited to see what comes into the foundation. So,
All right,
looking
what
forward
other
to it.
opportunities other than sabbatical? That's exciting enough as it is, but what other opportunities, grant opportunities are coming up?
So we actually have a Community Progress Fund opportunity, which will be available on our website at the beginning of October. So
And it's called, tell me again what it's called?
the Community Progress Fund.
Okay. So you're going to tell me more about that later on, maybe, when we come back, and we're going to tease you with that. Okay. Before we lose time, though, I want to put this up on screen because Shaheen has referenced the website, so let's do it. ZSR.org is the website, www.zsr.org, with all sorts of great information that you can find out about all the great things they do to help improve quality of life throughout the area. Ladies, thanks for doing this.
Thank you.
Thank you.
All right, we'll be right back. Today, and always enjoy when this special guest can drop by. She's been here before. Always glad to have her back. Taylor Thornton is, among other things, she wears many hats, but she's Director of Community Relations for Ridge Care Senior Living, and we welcome you. Good to see you.
Good to see you.
For folks that may not know, just in generic terms, what's the difference? What's an independent living community, and how is that different from assisted living community? Tell me about the two things.
So it's basically a difference in the care that we can provide. Independent living is exactly what it says. It's independent. Residents can come and go as they please. We're simply there. Our staff, CNAs, are simply there if they need us. Assisted living is definitely a little more hands-on, but independent living is really a great way to get started into a community, kind of get your feet wet.
And for those of us who've had a family and friends in assisted living, and you guys do a great job with that too, that's when they do need certain assistance, and there's nurses available and that kind of thing. But let's focus on independent living. There's something that you emailed me about, and you called it Summit Care at Home. Summit Care at Home. Now, I'm living independently in independent senior living. What does Summit Care at Home have to do with that?
So Summit Care at Home is part of Rich Care. It's our company, but they only work in our building. So it's essentially like home health. They can do things from helping you take a shower, helping you get dressed in the morning, get ready for bed in the evening. And a big thing that a lot of our residents use are med reminders, because it's complicated sometimes when you're on different medications that you have to take at different types of the day.
That's
times of
true.
the day. So they're there to provide that support in a very in controlled environment, but also still residents can still drive. They can maintain their independence. They're just there for in case they need any.
Yeah, and you may come into a situation where you start out in independent living, and then you say, you know, I would like a little bit of assistance on this and that. Now that brings me to the next question. I mean, is it the thing where there are different levels or different packages or things that you can choose from? So if I'm living independently, but is there a way I can choose what kind of services and assistance I might need through Summit Home Care?
Sure. So we build packages for residents. There's no overarching umbrella of you have to do this. It's based on every resident and their care needs. So we can do things from washing laundry. We base it off of how many visits per day. So how many times a CNA is actually in their apartment. And they, can do a med reminder in the morning and in the evening, and then help with a shower on certain days of the week, and then help do laundry other days of the week.
Right.
It's also very fluid. So if you have an injury, maybe you've hurt your shoulder and you've had a hard time putting your clothes on over your head and you just need some temporary assistance, then Summit Care at Home is a really great resource for you. It prevents you having to go to a rehab facility. You can come back home and we can help you do everything at Arbor Ridge at Kernersville.
Well, I didn't think about that. Yeah, that's a big plus, not having to transport or get transported to a rehab place. You can just do that right there. I think that's great. Let me put you on the spot of something. We didn't rehearse this, but I know you worked so actively in the community at large with people. And I'm thinking about asking you with if you have an older person, a loved one, and it comes time where you think they need to look at maybe an independent living or assisted living, what's a good way and a good time to try to sit down with your folks and figure out, how do you talk to them about it, and what's your advice on that if families are thinking that way?
Yeah, my advice is call me and talk to me. It's no pressure. We can sit down and have a conversation and explain the options. I think a lot of people wait too long to make a decision before their loved one isn't even a candidate for independent living. There's a lot that we can do to help residents maintain their independence. So just make a phone call and reach out to us. Let us talk, see if they're a candidate. Let us come to their house to meet them. We do an assessment to see that they're a good fit for independent living and what services they may need. And that's just, it's at no cost. And it's just a good way to give families an idea of where to start, where to begin looking, and how we can help.
And it helps to have those conversations in and among families when there's someone like yourself to help us sort of moderate that thing. On screen, before I let time get away from me, ridgecare.com is the website, or you can call 336-993-7555 to schedule a consultation or a tour of senior living community. And Taylor, we appreciate all you do for folks.
Thank you. Thanks for having me.
All right. We'll be right back. On Triad Today, just about time for the roundtable, but a quick shout out to our friends here at the Senior Botanical Garden. Their website's on screen, so visit that. Visit the garden, come out. It's a great place. And it's a great place always when we have these three folks together. On my right, Ogie Overman, but he's at the political left, but he's on my right. Great broadcaster and journalist. And a special guest is coming today, Wendy Poteet, who is the lovely and talented president and CEO of Say Yes Guilford, which really helps a lot of kids get ready for college. And speaking of a youth, here's Keith Granberry, founder of Helping Hands Consultants. Good to see you guys. The city of Greensboro is deciding how to allocate their $60 million in COVID relief funds. They've already given $860,000 to the Tanger Center, but they're going to figure out how to allocate the rest of the $60 million. Other cities are spending the money on fighting homelessness, workforce development, internet access, that kind of thing. Guys and gals, how do you think Greensboro should spend the relief funds, A, and B, was it okay to go ahead and give that money to Tanger? Ogie.
Yeah, I have no problem at all with Tanger. That's that that's a drop in the bucket, but there's a lot to spread around. That's a big topic, and you can't give it all to one person. There's a dozen or 20 different projects that need help, so I
Where
can't.
should it go?
Yeah, I'm okay with it going to Tanger Center. You have a $93 million investment. And Greensboro set priorities, I think, around what they would pay some of the money to, and I think cultural arts dropped into those categories.
Right. What about some of the social services or workforce development?
Absolutely. I think they'll figure it out, though.
Keith?
I don't think you start off with giving money to Tanger. I just don't think that's the right place to start now at the end, but there's youth programs that Wendy has. There's a variety of different programs, homelessness, jobs are way down, job training. There's so many other avenues that you can spend this money. You start off with Tanger. I just don't get that.
Yeah, we'll see what happens. It's an ongoing thing. A new report says the state is still helping to fund private schools that have anti-LGBTQ policies. Should our state legislators say, that's it, we're going to cut off this money, it's not fair? Or if cutting off their money would discriminate against those schools for religious reasons? Ogie?
Well, if they're using that religion as their reason for discriminating against the LGBT.
Not hiring it, yeah.
Why are we funding them in the first place?
Yeah, well, that's the point. So, Wendy?
I think the bigger question is what the state law says. Like, state law allows private schools to have those discrimination policies in place based on sexual orientation. So first thing we should address is, why is that law and policy allowable in North Carolina?
Ms. Cranberry?
Discrimination is discrimination, and I think there should be some lawsuits against that to ensure that everyone is treated fairly.
Meanwhile, a preacher in Oklahoma is issuing online COVID vaccine exemptions to anyone who makes a donation to his church. Thus far, he's issued, get this, 35,000 exemptions. Should the church be stripped of its tax-exempt status? Should people even be allowed to refuse the vaccine on religious grounds? Ogie?
I'm just sick of it, Jim. I don't know why. I'm losing faith in humanity. What kind of preacher does? That's just.
He's making money off of it.
That's it.
Wendy, what do you think?
It makes sense. He's running for U.S. Senate, right?
Yeah.
So that's the type of person he is.
Yeah. Keith?
Well, you know, I just hate it. I had a friend, childhood friend named Fred Munger, who just died recently from COVID. He came back. Once he got sick, he took his first shot, but it was too late. And people giving exemptions when death is at our front door just doesn't make sense. If he's running for any office, he should be not only not elected, but thrown out of his church, period.
Yeah. A North Carolina court has ruled that the voter ID law passed by GOP legislators is racist and unenforceable. Clearly, there's no widespread voter fraud, and there was no reason for it. But playing devil's advocate, on the other hand, what's really wrong with requiring someone to produce some kind of ID to vote? Ogie?
Well, first of all, it's based on a false premise that there's no voter fraud, period.
I understand.
But it does clearly it suppresses people who are likely to vote Democratic, poor people, minorities.
People don't
that's
have a driver's
That's the bottom
license.
line.
Wendy, what's wrong with just saying you got to have an ID to vote?
It's a point of privilege. People don't even recognize how hard it is for some populations of people to have an ID, the type of paperwork that you may or may not have. If it's a racist act, then it's laser focused on being discriminatory and setting barriers for people that you know are not going to vote the way you want them to vote.
Right. What's wrong with having an ID, Keith?
You know it's voter suppression, Jim. Let's not come on, Jim. We know that there's no voter fraud. No, not anywhere in this country has there been much voter fraud, and we understand what it's like. So let's not play these games.
In fact, the only big voter fraud case that we had was by the white Republicans down in Mecklenburg. That's weird. All right. College debt and student loan debt, an all-time high. The average undergrad is leaving college with over $20,000 in debt. If they're getting an advanced degree, it could be 3-4 times that. Once and for all, guys and gals, should government provide totally free education to all colleges and universities? Ogie?
No, I don't agree with that at all, Jim. There's got to be some value to it, an college education, and you've got to earn it somehow. There's plenty of scholarships and work-study programs.
And there's the scholarship lady right there who does so much for so many kids. But if you take yourself out of your job for just a second, would you be happy if everybody's tuition and everything was paid anyway?
I think keeping myself in my job, even with the scholarships that I give out, it's still not enough. We're supposed to be the greatest country on earth. We can figure out a pay for everything else that we want. we should be able to figure out a pay for education.
Right. Keith?
Economics should, anyone who has economic problems should have free education. Community colleges should be free, and those who can pay should pay.
And a lot of the community colleges, as we know, are doing programs where they give free tuition. All right, finally, a new study says the best way to prevent a thief from picking your pocket is to put a crayon in your wallet. Guys and gals, have you ever had a wallet stolen, and would you be willing to put a crayon in it? Ogie?
I've never had my pocket picked, and I can honestly say I've never given it one thought in my life.
Really
putting
haven't?
a crayon in my wallet.
What do you think, Wendy?
I've never had my wallet stolen, but I could probably guess with my grandson being around so much, I might have a crayon in my wallet, so I might be safe.
Your grandson may have a crayon he can lend you.
Right,
But, Keith, you ever had your wallet stolen, and would you consider putting a crayon in your wallet?
I have had my wallet stolen, but when they steal it, they're just practicing because I don't have anything in it, no money. I don't know why they would do that.
Keith's
They might want to give it back
Keith's got
with
all
the
his
crayon.
money. Yeah, his money's, it's all in a mattress.
So it just
we're going to
practice.
give you Keith's home address, and you can get the money out of his mattress. Well, that's all the time we have. Oh, except for this. Researchers in New Zealand say... Thanks. Researchers in New Zealand say they've discovered that you can potty train a cow as easily as you can a child. They say they just potty trained a calf in 15 days. Asked why they would even do this, one of the researchers said, hey, it's New Zealand. What else are we going to do? That's not really nice for New Zealand, but that's probably true. All right, for all of us here on Triad Today, we're going to Keith's house and look under the mattress. We'll see you next week.